And we're live. So I'm going to just wait for a few people to join us, and then I will introduce you, and then we can get started. Okay, so welcome everybody to another session with Virtual Dental Shadowers. My name is Gazelle, I'm the co-president, and today we have a wonderful guest. It's Dr. Ciapciak, and just wanted to let you guys know that we do have a quiz if you want to gain shadowing hours. It will be posted in our link tree on our Instagram page, so be sure to head on over to that after this is done and to get your shadowing hours. And I will hand it over to Dr. Ciapciak.
Hello, welcome guys. I'm Dr. Ashley Ciapciak, and I'll talk you through everything. I'm also streaming on TikTok, so if you found me there, give these guys a follow on their TikTok too. They need more love. Okay, so who am I? Why do you care? Background info. You pronounce my name chap-chack. I have an English bulldog. His name is Chap-chack. That's how you can remember it. He looks like a pancake. I'm a general dentist. I graduated from Villanova University with a bachelor's in biology. I had a minor in psychology just for fun. I think it's a really interesting subject. I went straight through. I never took a gap year. I went straight into Boston University Dental. I'm originally from Boston, so it was an easy choice for me. And I graduated in 2020. I'm currently now the owner-operator at Brede Ciapciak Dental, which is a family practice. My dad is a dentist. He's planning to retire in the next 5 years or so. And my grandfather was a dentist. He has not been practicing for like 15 or 20 years at this point, but it runs in my blood a little bit. So a little bit more about how I kind of came to be, how I got into dentistry. I started as a dental assistant, so the picture that you see on the far left of your screen, me and my pink scrubs. I was, I think, 14 in that picture, which sounds absolutely crazy. Dr. Brede goes to India every summer. We run a dental clinic there with local dentists for 300 HIV positive orphans. They don't have access really to dental care where they're at. And so we've been going there since I was basically 13. So I started there, started as a dental assistant, started working every summer, worked every weekend that I could, dental assisted for about 8 years before I started dental school, and then worked on Saturdays as much as I could. Next picture is me, I think first year of dental school. My first, procedure with my fake head. I wasn't even in the school issued scrubs yet because we were brand new. They didn't even order them yet. Worked my way through. We start to practice on each other in dental school until you then see your normal patients. So this is my friend practicing on me. I think that was stab lab day. So I think we numbed each other that day. Obviously had a good time. Graduated, like I said, in the middle of a pandemic. So no real celebration. That's okay. I'm a practicing dentist now. I don't really care. Last pick is my current office. Okay. So your preceptors, your leaders asked me to talk about study tips and what worked for me. I want to preface this by not everything that worked for me is going to work for you. So a big part of the learning curve of dental school is learning how you study particularly. And that's something that's gonna come eventually. It takes some students longer than others to figure that out. Maybe you already figured out what works for you in undergrad. I'd hope that for you. I didn't know how to study until I got into dental school, so it took a little bit of time. What worked for me though, if my things want to work, I made a ton of study guides. So I found myself unable to grapple with all the information coming at me without kind of compressing it into charts and lists and mnemonics and things like that. And I'm a very visual person. I think everybody going into medicine in general is pretty visual naturally. We're used to pictures, we're used to diagrams, just the science is like that. So I found myself making a lot of study guides. Not everybody in my class did study guides. Actually, a lot of my classmates read my study guides and that's how they studied. So that's fine with me. They didn't make them, they studied off of them and that worked for them. I was fine sharing them. I knew I wasn't interested in specializing. I'll go into that a little bit. But flashcards, things like that, you don't really have time to make. So copy and pasting into kind of a study guide list made sense for me. I gave some examples here. So this is a partial denture exam study guide. I have some charts. I was really into charts. If you see class 1 is a 2, 2 is a 1. That's still a phrasing that I remember to this day. If it's purple, it's my mnemonics. I always went back to that same color coding. You'll see gas, ill, EIE. That's still a kind of mnemonic that I use to this day. So anything that you can do to make yourself remember it long term, especially if you're going into general dentistry, you're going to need to use this information throughout the rest of your life. Unlike undergrad, where you can kind of just dump it after the exam, right? Another example of a study guide, I was really into color coding. That really stuck in my brain. I always picture centric relation as red in my head. That's just how it worked for me. Again, other examples of things like this. When you have so much information, this is cephalometry. I don't even think I'm saying it right. It's ortho, basically. So if you're into braces, you're going to have to learn how different people's noses are positioned, the different bones in the head. Of course, you're going to have to know. But remembering all those angles and all those locations on your ceph, it gets difficult. It's a lot of information quickly. So study guides worked really well for me personally. I wish somebody had told me this before I started dental school. Buy head and neck anatomy flashcards. Netters are incredible. You're going to have to study out of this textbook anyways. It's too much. Anatomy, if you haven't had the class before, is a lot of information. I think it's too much information. As dentists, head and neck anatomy is really, really important for obvious reasons. I need to know where the nerves are. I need to know where the veins are so I don't inject into the vein when I'm trying to hit the nerve, right? Or if you're into Botox and fillers and things like that, this major venous drainage picture, you don't want to hit a vein when you're filling someone's lips. So flashcards, they're $40 on Amazon. They're pre-made for you and they quiz you on absolutely everything. Those were incredible, really helpful for studying in dental school. They also asked me about community service. So I hinted at this. I grew up in community service, so most of my volunteer hours were through the organization that I go and visit in India every summer. If you're interested in that, we still do trips. We haven't been able to go for the past 2 years or so, obviously because of COVID, and our kids are already immunocompromised. But if you're interested, at the end of this presentation, I have my information, my TikTok, my Instagram. Shoot me direct messages on either of those. I can send you some information about that. We still do go every year. Again, I started the picture at the far left. I don't know why I wore pink scrubs. We're going to get over that. I started as a dental assistant. So I was learning how to sterilize instruments safely, learning infection control protocols, which are very important nowadays, right? With COVID, hand washing, mask wearing, things like that. I really just started as a helper. So we have room for everybody on this type of trip. The more exposure you can get to the field, I think the better. So a great way to do it is outreach. This happened to be international outreach. I've been 10 times now on this trip, basically. So great way to kind of bolster those hours. I've found that my applications or my dental schools kind of expected community service. I think that you guys have probably already experienced that with undergrad. Just schools in general are really competitive, right? So we know that medical schools are competitive. Dental, I think it's 4% of applicants actually get a seat or actually start in dental school. So it's competitive. Bolstering yourself with some community service is a great way to see more mouths, get more exposure, and experience a different culture other than your own, whether it be a local culture other than your own or international. Okay, choosing dental schools. How did I choose? So first of all, you need to get in to the dental school. And that sounds ridiculous, but I applied to, I think, 12 dental schools. I got accepted ultimately into 2. I interviewed at 2, got accepted into both. The 2 schools I got accepted into were both Boston schools. So I got into Tufts and BU. I'm from Boston. I was really interested in going to a Boston school. I think they saw that on my application. I did most of my work, my dental assisting stuff in Boston. It's really important to get accepted first. Choose from that list. Be realistic. Again, the percentage, the chance that you'll get into a dental school is a little bit low. It's not like college. You can't really rank your list. You have to rank it once you're accepted. So step one, get in. I chose based more on reputation and ranking and kind of the general feel of the school. At the time that I got in, BU was ranked higher, so I chose, as part of that, I chose BU. Also, I think it's really important to get an idea, at least, on what the lifestyle is like. What do the students experience? What would a day-to-day life be like at this school? Different schools do things so differently. So, for example, the exam schedules, something I thought I would like at BU, pros and cons, definitely. I thought I would like that BU has exams kind of rolling throughout the year, for example. So first year of dental school, for example, we had lectures from 8 a.m. until 5 p.m. every day with an hour for lunch in the middle. So that was Monday through Friday, 8 to 5. It sounds, that's doable. Until you realize we also had exams every 3 days or so because of that rolling exam schedule. So it became, it kind of became that I'm constantly studying, or I'm taking 2 or 3 days to study for this exam, take that exam, and then I'm always studying for the next. So I think there's pros and cons with that. Other schools might make you take all the lectures and then have all their exams in a block schedule at the end of the year. Some students might do better with that style. Some students might do better with the BU style. So definitely something to be aware of and definitely something to ask about, especially if you already kind of know which style might work best for your learning, learning skills and habits. Something I wish I asked about, but I didn't, was how we're graded. So BU is, I don't know if it's unique, but I liked what they did with grading. So we were graded on competencies. So we were graded on basically how well you did something. We were not curved. That's an important question to ask. So theoretically, if everybody got 100% on an exam, everybody could get an A in that exam. Everyone could get an A in that class. Other schools do curve. I don't think it's super common anymore, but if they're curving and, most of the class got 100%, but then a few people in the class got 89%, they're going to curve those people in 89% to an F. Something to ask about, something to consider. Our school is not pass-fail. Most of the schools that are conjoined with medical programs, so University of Connecticut, for example, is pass-fail because the med school is pass-fail. Something to ask about, they'll still rank you usually. So if you're interested in specializing, even those pass-fail schools will rank you so that specialty programs can see that and kind of see where you fall in the class. Something also to ask about that I didn't was patients. How do you get patients? Are you assigned patients from the school? BU was. So we were assigned our patients. The school had kind of a big list of patients and they were divvied up amongst group practices. Do you have to get your own patients? Now, getting your own patients, I was talking to Scott. He was one of the leaders of virtual dental shadowers, and he said he's from Spain. It's going to be really difficult for somebody from Spain to move to Boston and try to get patients of their own here because they might not have that many connections. So something really important to ask about. If you're from the area and that doesn't make a difference to you, no big deal. But different schools, might assign you patients, or you might have to get your own patients. Some schools assign chairs. We weren't really. They kind of booked us appointments whenever the patient was available, and our schedule was free. So our front desk kind of work was actually covered for us by the school, which was, I thought, incredible. Procedures offered. So again, different schools are going to offer different procedures. Something that I was really interested in, I knew that I was going to eventually take over Dr. Brede's practice. So my dad does a lot of his own dentistry. Now, nowadays, it's more common for general dentists to do crowns, fillings, and kind of basic exams. Many general dentists, not everybody, but many of them, refer out surgeries, refer out extractions, implant placement surgeries. They refer out root canals. Many, practitioners just refer a lot of things out, ortho, braces, things like that. I knew I didn't want that. I really wanted a school that taught me everything, and then I can, grow with that school and get extra training in things that I knew I would need in my practice. So, do you need a certain number of procedures to graduate, or do you need to be proficient at that skill to graduate? Different schools do it differently. Our school had kind of a mix of both. So something that was offered to me and is not offered at every school, it's not offered at most schools, is the opportunity to place implants. That's a surgery. I'll go into that a little bit in my shadowing section. If you have the opportunity to place implants, it's huge, big on your resume. People are going to want to offer you a job after graduating dental school because you've at least had some experience with implants. Implants are the future of dentistry, so definitely a skill that you should get if you're able to get it, something to ask about at your dental school interview. Digital dentistry, scanning, so we now can 3D scan to get impressions for crowns and dentures and things like that. Your school should offer, again, proficiency or training in CAD CAM or 3D scanning. It's something I didn't know was important until I was already in the process. Thank God BU offered that. It was fine for me, but something to ask about. Specialty externships. Also, I'm not sure if it's something that every school does, but if you're interested in specializing and you know that going in, not everybody does, and I understand that. But say, you really love braces and you've worked for an orthodontist for, a few years and you just really love that and you think you want to be an orthodontist. Something to ask about might be, is there an opportunity for me to spend a few weeks doing an externship or an internship or whatever with an orthodontist or with an ortho team and get a little more exposure with that specialty before you then apply for the specialty. Looks good on specialty applications and also kind of shows you if you're actually interested when you're doing the procedure, right? So a lot of people come into dental school and first year dental students often want to be oral surgeons because that's usually the only experience that they've had with dentists. They've had their wisdom teeth out or they've seen a pediatric dentist, right? Or they've had braces. So those three specialties, they know the most, but until that forceps is in your hands, you might not know what that pressure feels like, and you might not enjoy that. So asking about specialty externships, I think, is a good way to rule out certain schools or rule in certain schools. Dental school is expensive, really expensive. Massachusetts didn't have the option to go to a state school. Massachusetts doesn't offer, there's no state school for dentistry. Realistically, it doesn't matter where you go to dental school, you're still going to graduate as a dentist. If you can do that a little bit cheaper, I think it's something to really strongly consider. Had I had a state school as an option, again, I'm from Massachusetts, I didn't have that option. We have Tufts, Harvard, and BU, they're all private. But had I had that, it would have been really awesome because I would have saved a ton of money. Dental school is the most expensive postgraduate program out there, period. So look into that, look into the costs, try to be a little more financially responsible, lean into that information. Specialties, I touched on this a little bit. There are, I think, 12 recognized specialties now. So you've heard of some of them. I mentioned it, some of them oral surgery. So they extract teeth, they place implants, they do biopsies, things like that. Orthodontists, many people have heard of. Prosthodontists, periodontists, we have pathologists, we have radiologists, head and neck radiologists. There's a ton of them, you can look them up. There's big differences from general dentistry to specialists. I'm a general dentist, so we know I lean on this side. I really do love what I do. General dentistry is 4 years of school. Specialty training would require those same 4 years, but then additional training. So anywhere between 2 and 6. You need extra training. You're going to pay for that training at many programs. Some programs, a very small handful, will pay you a stipend, so that's kind of nice for that specialty training. But once you go through it, you're going to make significantly more as a specialist than you're ever going to make as a generalist. That's across the board. So, similar for med students, if I have any pre-med people following this, similar things. So primary care physicians just realistically don't make as much as a surgeon is going to make. Because of the procedures. So the procedures that you're putting out don't have as high of a pay back, basically. General dentistry is fantastic if you love variety. I love variety. So I go to work, I'll go into kind of a day in my life, but I go to work and I might go from a root canal to an implant placement to an extraction to a consultation with a 4-year-old about, does he need an early ortho intervention or something like that. I love that. Not everybody thrives under variety. It's definitely something to kind of know about yourself. Maybe you're somebody that, really likes the same schedule every day or the same types of things every day. I think their, specialties are much better for that. If you're an endodontist, for example, you're doing root canals all day, every day, pretty much. You might have a few, different procedures, maybe an apicoectomy here and there, but you're doing the same thing over and over again. And if you're good at that and that's what you like, I think that you should consider specialties. Sometimes grades limit you from considering specialties. Realistically, you have to be in the top 10, 20-ish% of your dental class, by ranking, to really realistically consider a specialty. So again, if you're working your way through dental school and you find, my grades just aren't meeting the cut, you're still going to graduate as a dentist and you can still do those procedures that you like. Say you really enjoyed minor tooth movements. You can do Invisalign, do it. Do ortho. You're allowed to do whatever you want as a general dentist. Specialties, you're limited to that specialty. I listed the highest paying, lowest paying, if that's something that you're interested in. What does my life look like? So my schedule's pink, obviously. I put myself in as patients, so that's why it says my name over and over again, because I didn't want patient information all over the place. But if I just follow, this is a 3-op system. I have 8 operatories, but I wasn't going to spend all day plugging in everybody in different operatories. It just, it was a lot to just figure out a sample schedule with me as a fake patient in it. But what my life looked like, I hinted at, I jump around a lot. There's a lot of variety. So I work currently, because of COVID, 7 a.m. to 3 p.m. Pre-COVID, we used to have lunch. We don't currently take lunch because we didn't want to take our masks off. Now I'm vaccinated. We're going to go back to a more normal schedule. But anyways, I might have a patient in operatory 1, for example, who needs full mouth extractions, and then I'm inserting dentures. That's cases that we do. I often book 2 or 3 hours for that because it takes a long time, the extractions, the anesthesia, the inserting of the dentures. So it's a long procedure, a long time block. During that time block, while the patient, is healing, or my assistant is, turning over the room to then insert the dentures or whatever, I step out, I check on my hygienist's patients in Op 2. My hygienist might be doing a deep cleaning. Then she might have another patient for just a routine visit for x-rays. Somehow now at 7:30, we got a phone call. Another patient is in an emergency. She's really uncomfortable. She needs to come in. She has toothache, she thinks. So my front desk books her at 7:30. Oh, wait, I'm supposed to be in 3 rooms at the same time. Right. It gets a little crazy. That's why we have assistants. That's why we have staff. And that's why we a lot of your age group would say, my dentist kind of stops in for 10 minutes and then leaves. This is a little bit of why. So then I might start a root canal or start numbing, this patient in Op 3 while I'm finishing up the patient in Op 1. Then I have, a root canal and a premolar while my hygienist is, doing her normal cleanings with some x-rays. And then I might go back and do a filling and then crown preparations and core buildups. And then a new patient comes in at 1:30 and I'm doing a comprehensive exam, which takes a little bit longer. New patients always take a little bit longer, a little more TLC. And some x-rays there, and then again doing some exams for my hygienist patient. I missed the toothache in Op 3 at 10:45. It gets a little hectic. I love that. I thrive in that. Not everybody does. So again, back to specialties, something to consider about yourself, what you might thrive in. Okay, into the good stuff. So let's go through a few cases. If you followed me or saw my Club Med, one, I tried to switch it up a little bit, so there shouldn't be that much repeats. This is a little bit of a repeat, so I'm sorry if you followed that one. This patient presented to me. She's 46. She hadn't been to the dentist in, I think I said 12 years. It was much longer than that. She was very afraid. The first time I met this patient, I was just trying to take x-rays and just kind of do an initial exam, and she was a dental school patient. That's why I have such good pictures because I always forget to take pictures in my private practice. This patient was in full-blown tears, that nervous to see me. How do we combat that? We take our time. We explain things. I didn't have access. I couldn't give her medications because I was a dental student or whatever, but we combated that and got her through a lot of treatment. So this patient presents with periodontal disease. So periodontal disease, what it is, if you don't get professional dental cleanings, basically, or you're not maintaining your own home care, the bacteria, the tartar, the bacterial biofilm, basically, that builds up along the gum line, builds up there and then is never professionally cleaned off. It's never professionally removed. So ultimately, it kind of tucks itself up under the gum tissues, and bone doesn't like to live next to bacteria. So as that plaque is kind of inching its way up and underneath the gum tissues, the bone kind of pulls itself away. Eventually, the tooth is just chilling there, but the bone is sloughing itself away. We have deeper pockets, if you've heard that terminology. We have deeper measurements, deeper probings, again, all the same terminology. Ultimately, we have severe bone loss everywhere. This tooth, can I point on this? I don't know if you can see. If you look at her two centrals and look at the tooth, so top right picture, if you look at the two centrals and look at the tooth to your left, patient's right, it looks like there's kind of some gray filament along the gum line there. I could take an instrument, this is my straw, I could take this instrument and anchor it 8 millimeters, 10, 12 millimeters up into that gum tissue because there's no bone supporting that tooth. That tooth is quite mobile. The adjacent teeth were a little bit mobile. That tooth was like this. So the patient spoke to me. That tooth was moving with just breath and speech. So obviously that tooth is heavily infected, no bone surrounding it. So what do? Panic? Just kidding. We do a full exam. We do a full workup. We take all these x-rays. Unfortunately, ultimately, I couldn't save the upper teeth. There was too far gone, basically. There was too much bone loss. So the picture to the bottom right is the patient now edentulous. We removed all of her upper teeth. I was able to save the lower ones. They weren't as badly affected. Why? I don't know. I didn't talk on her marijuana history. Sometimes, smoke, it might go up, or you're holding, a joint or a cigarette or whatever between the front teeth. Often smoking associated pathologies and stuff affect the palate, the roof of the mouth. So perhaps these upper teeth were a little more affected than lower teeth for different reasons. But ultimately, we had to remove all the upper teeth. So I love cases like this. I love dentures. The upper right picture is her with her denture. So that's the final denture I made. Maybe you can't tell, but she was in full-blown tears when we put that denture in because that means night and day, life-changing. I put 1.5 because this is also a really interesting denture case. I'm not going to go into the full details, but this is an incredible before and after. So if you want to go into general dentistry, you get to do stuff like this every day, and it's really cool. This patient was in a coma for 1 year and then didn't go to the dentist for about 11 years after that. Really difficult medical history. He had agoraphobia, so he was afraid of leaving his home. So for this patient, if you can't tell, I couldn't save any of those teeth. So this canine, the one white tooth that you see with the crown, was the only tooth that was kind of stable. It had a crown, it had a root canal, it had treatments done, but I can't do anything. I can't really build anything around one tooth. So that tooth had to come out because I couldn't fabricate anything just around that one. But nobody cared for this patient's teeth during the time he was in a coma. And so all of his teeth, became carious, became rotted out is a term that you might know. He had big cavities, right? So we had to remove them. This is the patient with dentures. He's young. He now can smile. He can now chew. I don't know how he, was chewing before. Patients like this are more common in, so for example, my dental school was in a difficult area of Boston. I also worked in a federal prison. I saw many patients with similar smiles in federal prison just because of lack of dental care, realistically. So cool before and after. That's really why I'm showing that one. Another dental case. I don't know why all my main cases were female. I'm sorry. I wish I switched it up. I also spelled Caucasian wrong, and I'm just realizing that. So 62-year-old, I don't think we're using the term Caucasian anymore. We're using white now, whatever. I try to be PC, so I'm sorry. I didn't even spell it right. 62-year-old female, light-skinned, very light-skinned. And she hates how her teeth look gray. So she was 62, sorry. She just retired the year before. No meds, no allergies, really healthy. But if you look at her smile, I thought she looks beautiful. I think she looks absolutely fine. A little bit of chipping on this, on her upper left lateral incisor. Yeah, fine. Nobody really notices that stuff. Maybe the right one looks, the right lateral incisor looks a little short, a little square. here's a close-up upper left side. The gum line's a little bit undulating. She has a little bit of recession in the on her upper right lateral incisor, which is that small tooth. Kind of looks like a U shape, maybe. You know, she might have bitten her fingernails there, whatever. I didn't think the shade was bad. I think the shade is fine. It's not something I don't comment on people's smiles unless there's a medical indication to. So cosmetic dentistry, I do it. But I would never go out and say, you know, oh, your shade of your teeth looks X, Y, or Z, right? So this patient came to me and felt that her teeth were gray. If you look closely, there's a stripe kind of running across. It's more clear on the patient's upper left central incisor, so that big tooth to your guys' right. You can see a little stripe. Clinically, it was more clear, so she had quite a bit of banding across her front teeth. Can you get Flashcards? I'm sorry, my bulldog is acting out a little bit. He's excited. He must be part of the fun. So there's banding in general across the front teeth. So what she had taken tetracycline as a kid. This staining on her teeth is deep set. We can't whiten out certain stains. So tetracycline staining is built into the tooth structure. That's why we don't give tetracycline as an antibiotic to kids anymore, because when those teeth are developing, we don't want this banding pattern to happen for them. So again, she presents, she wants me to whiten her teeth. I can't whiten them without doing something like veneers. So this lower picture is the preps. So light cutting, I cut maybe half a millimeter depth wise into the tooth structure. And the upper right picture, I don't love personally because they look just white and square. I like people's natural teeth a little bit better. The material that we chose doesn't have as much. She didn't want to go with porcelain. She has a history of clenching and grinding her teeth. Porcelain veneers tend to chip a little bit easier. These are Emax if you're familiar with different dental materials. These are a little bit stronger, actually significantly stronger. So we went with that material, but it's a little more flat, opaque, but she loves them. This is a cosmetic case. So ultimately your goal is to make the patient happy. And she loves that look. You know, we tried them on as temporaries. We tried them on before, the shape, the color. This is what she was looking for. She might go back and add additional similar veneers to the premolars just back behind those canines because it looks a little dark. So when you see her smile, it's a little dark moving back. But again, cosmetic case, this was her ultimate goal. We met that ultimate goal. I think I loved her natural teeth personally, but it is what it is. Okay, this is a good case. I'm working through this case right now of kind of how can dentistry go askew when not everything's perfect, because I can show you all my perfect cases, but then, you know, we wouldn't learn. So this patient's 55. She has a few allergies, bees, latex, you know, whatever. We don't really use latex in dentistry too much. We do sometimes use it for implant placement, gloves and stuff. Often our latex, you have to request latex-free ones. Anyways, she lost many of her teeth. She had pretty big cavities growing up. She also went to a fake dentist. So this is a real thing that happened. This was, if you're familiar with the Boston area, this was like 2 towns away from where I grew up. This dentist practiced for, I think, 20 years or something as a pediatric dentist. He had never been licensed, had never been to a dental school. I don't know how he just opened up shop, but patients went to him. And so unfortunately, she had a lot of dental anxiety associated with dentists because of that fake dentist. She lives off the grid, so she travels pretty far to see us. She travels about 5 hours to come see us. And ultimately, her goal is that she wanted teeth to smile with. So I'll show you some other pictures, some surgical pictures. If you're not into bloody, gory stuff, close your eyes, turn the screen off, whatever, look away, because these are some gorier ones. This is implant placement day, so surgical day. Again, her ultimate goal is she wanted some teeth to smile with. She hated the removable appliance that we made her for many reasons, mostly whenever patients are in complete dentures or all acrylic partial dentures, it covers the roof of the mouth and things can taste different. Heat doesn't transmit as well. So when patients are eating food, often they'll make their food a little bit too hot, but the palate, the roof of the mouth is covered with that acrylic piece, that acrylic appliance. So they'll swallow the food and then they'll burn their throats and it's very uncomfortable. They feel like they can't taste because there are taste buds on the roof of the mouth. So for many reasons, she absolutely hated removables. was not a fan. Implants were for this patient. But it's not a perfect treatment plan because she didn't want implants in the lower. She has no back teeth, period, anywhere. My goal, I need to create back teeth to have support for front teeth. You'll learn that in occlusion, you'll learn that in dental school. But basically, this is non-ideal case. I don't have back teeth supporting these implants. These implants are essentially useless because I don't have those back teeth support. So I'm building it slowly. I'm hoping that she kind of comes back and understands that as we fabricate these. But picture to the far left, you'll see that little healing plug, so that little black circle, that black plug. That shows where the implant is placed. That allows or prevents bone from growing up and over and into the implant, so it kind of keeps it safe. The tissue that's peeled back is gum tissue, so that's bone, so you're looking directly at bone. Periosteum is also peeled off. And then middle picture is the two implants on her upper left side. I always mix up this case because she's parallel, but we only did one on one side and two on the other. So I have to double check my notes. Oh, sorry. Clicked forward. Suture day or sutures at the end of the case. If you'll notice, this is the mounted model. This is what the lab mounted it on. This is where the whole case went wrong. So patient comes for uncovering day, which is now I need to find the implants basically in the bone. I need to take some impressions and send the impressions to the lab. Now I had discussed with this patient, I can place the implants very close to her adjacent teeth and just fill in those gaps, or I can place them a little further back, knowing that ultimately she only has 5 upper teeth left. She has 6 lower teeth left. Ultimately, she will likely end up in dentures. So many people nowadays prefer implant supported dentures. So if I can space the implants out, theoretically, later I can use those same implant bodies because they're a little more spaced out to support a denture rather than just kind of putting them all in the front. It's a treatment planning decision that we made together. Is it going to have the prettiest result? Absolutely not. If you look at the picture to the far right, you'll see it's blurry because it's the lab's picture. I didn't mount my own case because I haven't done that since dental school. The implants are further back. So it looks like they're almost 2 teeth spaces back for both sites. So theoretically, they will be able to kind of make a false tooth in the front, giving her that smile, but also giving her further back teeth. Not an ideal case, period. I wish that I could have planned it to have, 3 or 4 implants up there, or wish she liked the removables. I think it would have been a better result. The other problem was she drove 5 hours to see me. I called her maybe 2 or 3 times that she needed to bring her lower appliance that I had also fabricated for her so that the lab had some sort of relation for her bite, because again, front teeth are shearing teeth, so they just slide past each other. If I have no back teeth to kind of stop your jaw from moving, it'll just continue to move. So that's why if you follow, if you're on TikTok and you follow Gabby Warrior Queen, love her content, but she has dentures. She's pretty young and she expresses, her experience with that, but she can overclose her jaw like this and have her lower jaw, very forward, because there's no teeth to prevent that movement from happening, prevent that lower jaw from really protruding forwards. Same with this patient. I can't get a reproducible bite for 100 different reasons. She forgot her lower appliance. Am I going to make her drive 10 hours to go all the way back to her house and back to us? No. So it is what it is. Not everything always goes right. Again, for this patient, we'll do what we can. She just wants the teeth really for smiling. I'll be able to unplug those pieces if they don't fit later and kind of modify it, but not everything always goes peachy. So on that sad note, I guess, we're going into a Q&A. That was all my cases. I hope that was enough information for y'all, but.
Yes, so we definitely did learn a lot. Those are really interesting cases. Thank you for presenting those. So let's go to the questions. We have a few in the YouTube chat. So the first question that we have is, how is it possible to know what exam style a school has before accepting the offer?
Okay, so good question, because it's a little bit different than how your application process was for undergrad. So when you apply to a dental school, you send your big application to them. Oftentimes there's supplementary applications that come back from the dental school if they're interested in you. Then they offer you an interview. So every dental school interviews, it's a requirement. You have to go to an interview. Now, it's not just an interview, it's an interview day. So usually you'll show up at 8 or whatever, 8:30 at that school, and they'll basically host you for the entire day. They'll serve you breakfast. They'll have students give you tours. They'll have guides, again, student guides, showing you around and having Q&A sessions with you, answering your questions. I can't even speak, sorry. They'll have presentations, formal presentations about finances. They'll have formal presentations about student life, about things like this. So interview day is the best time to ask all your questions, because once you do your interview, then usually a week or two later, they'll send you an acceptance if you're accepted. So get all your questions out during that interview day, because usually after you hear back from the school, you have to accept them back within a week or so, maybe a month. It's a pretty tight turnaround though. Also something to note that I didn't touch on in this, I wish I knew. Submit your dental school application as early as physically possible. I know it's not the question that you asked. Dental school applications open in, I think, June, July. Get your application in ASAP, the first week if possible, the first day if realistically possible, because dental school applications are rolling admissions. What that means is the schools will reach out to you on a rolling basis. They'll read your application on a rolling basis. So if you're submitting your application in January, half of that class for that dental school is already full. They've already interviewed in the fall. Their seats are already taken. So your chances of getting in are much, much slimmer. Submit your stuff ASAP. But yeah, you'll be able to ask all your questions like this at that interview day.
Okay, great. Another question we have is, what is considered to be a pass mark in dental school?
So we didn't have pass fail, so I'm not exactly sure. Different schools would tell you that. Again, if they're pass fail, we just had normal grading, and then each class had different kind of grade scales of what would be an A, B, or C. They're usually pretty similar. Also, dental schools will often have certain things that you absolutely cannot do poorly in, if that makes sense. So for example, we had to pass, nobody could get below a C minus, I think, on the head and neck anatomy exams in our anatomy class. So practicals, meaning kind of identifying things on our bodies, on our cadavers, nor the written part of that exam. So you could not fail your head and neck anatomy practical or written part. You would not proceed in dental school. So also in our school, you can't get any Fs or you fail out of the entire dental school period. And if you get if you get 2 Ds, you have to stay back a year. If you get 1 D, you have to remediate that class. So they'll tell you that stuff once you get in. I'd hope you wouldn't be getting Ds in dental school, but it happens, I guess.
Okay. The next question we have is, can specialists do things that general dentists do?
No, not usually. It does not go the reverse. So when you become a specialist, your license becomes limited to an extent. So for example, when I prescribe medications, I can't just prescribe any medication I want randomly to whoever I want. There's rules with my prescription abilities. My prescription writing, for example, needs to be within my scope of practice. So I can write, anti-anxiety medications related to, I can write a few pills. I'm not going to be able to write you a year's worth of anti-anxiety medications because that's way out of my scope of practice. I can write them for that appointment. That's it. Similarly, an orthodontist, for example, cannot and should not be doing fillings, should not be doing crowns, cannot, per their specialty, do those things, right? They can't do dentures. What they can do is things that general dentists do that are specific to their practice. So for example, an orthodontist theoretically can extract teeth if that is related to their scope of practice. If that tooth needs to come out and they're comfortable taking that tooth out, they can do that, even though, they can also refer to general or oral surgery for that.
Okay, great explanation. The next question is, previously you said that implants are the future of dentistry. Could you elaborate more on that and why implants are the future?
Yeah, so good question. It's really all about what patients want, ultimately, is what drives, the future of anything. So for example, digital dentistry, people don't want a big gooey impression in their mouth. They just hate it. Who likes that? So, scanning is much prettier. It's much cooler. It, turns over, we use less material waste, whatever. So implants, we used to do bridges. I don't have the best things to hold, but if these are teeth, these are coasters, but if these are teeth, actually use this, and these are adjacent teeth, we used to fill a missing gap. If there's a tooth missing here where my head is, we used to have to cut crowns that went on top of these guys, these adjacent teeth, in order to then put a tooth, a pontic, a false tooth connected to them. And then once I cut the adjacent teeth and prepare them, cutting away 30% of the tooth structure, I can now have these three guys connected. Now this tooth and this tooth have actual roots in bone. This guy is just hovering on the gum tissue. But big con is I had to just compromise this tooth and compromise this tooth by cutting into them to prepare them for crowns in order to just support this middle guy. It's not a good option. It compromises, again, those adjacent teeth. Every time I cut a tooth, I risk endo complications. I risk nerve death. I risk nerve complications. So if I don't have to cut adjacent teeth, that's a big pro. Also, patients want, patients of the generation, whoever is the generation above baby boomers, basically baby boomers and below, do not like removable appliances. They don't like dentures. Their parents usually had dentures. They don't want to take things in and out of their mouths. They just don't. I hear it all the time. So the fact that they want something fixed in their mouth, and again, we don't have to cut adjacent teeth. There's of course cons with implants too. We do have 5% of implants fail. Some patients are not candidates for implants for different reasons, but in general, patients want implants. Dentists want implants, not because of a cost thing necessarily, because the cost of a bridge nowadays is similar. I don't know, maybe it's a few $100s different than just getting that single unit implant. But also they don't have to remove it at night. So seems to be the future. Everyone wants implants.
Okay, the next question we have is, if you have a patient that has something more severe than expected, for example, a root canal, would you refer them to an endodontist or do the procedure yourself?
That comes down to personal preference, provider preference. So that happens all the time in my practice. I personally am comfortable. I love root canals. I'm comfortable doing root canals. I don't think any of my friends who graduated dental school in my class are comfortable doing them. They just don't like them. So if you like the procedure and you're good at that procedure and you can do a good job by that patient, I believe that you should do that procedure. Patient's already in your chair, they're already in pain. If you can get them out of pain, I think that's a good thing. Now, if you're going to not do a good job, or if you're, for whatever reason, unable to do as good of a job as a specialist, then you should refer. For example, I don't like root canals on second molars. Look back in the back of your head, try to count your molars. Second molars are way back there. Oh my God, upper second molars, I can't see anything. It's miserable. My back hurts. I'm looking, upside down and backwards to see anything. There's usually 4 to 5 canals. It's just a miserable experience for me. So I refer those because an endodontist is going to do it quicker and they're probably going to do it more accurately. And they have bigger magnifiers. But I have a patient, who gets bopped in the chops and has a front tooth trauma, and it's 1 canal, and I'm going to do it basically the same amount of time as an endodontist, and I like doing them. So I'll do that case. Again, comes down to provider, how comfortable the provider is ultimately. And if they're good at it. If you're not good at it, refer it out, right? You want the best for that patient. I have a patient I'm referring for 6 implants. I can place implants. I do place implants, but 6 is a lot. I think that timing wise, it's a lot of chair time. That patient's going to have to keep their mouth open for much longer if it's in my hands versus normal surgeon. So I'm literally referring, not because I can't do it, but because of the timing that it would take. So it might take me, 40% more time to get the procedure done. So, referring next.
Yeah. The next question we have is, would you say it's relatively easy to get a good job in the dental field after completing dental school?
Yes. Yeah, relatively easy. All my friends got jobs really quickly. And this was a weird year too, because licensing was so screwed up with the pandemic. I don't need to talk about that. It's a whole rant for another day, but my class got really, was kind of put in a really tight place because licensing exams got canceled. So a lot of my friends hadn't taken their licensing boards. They were not board certified. They literally couldn't apply for their license. So they had to figure out all these things. Everything got postponed, everything got delayed, whatever. And still all my friends got jobs really quickly within, I don't know, weeks of looking. There's opportunities. Most jobs that there are opportunities at are the Aspen dentals, the general dentals, the corporate dental practices. Those are usually the practices that hire right out of dental school. It's pretty well known that that's, that those practices take right out of dental school. And it's because a lot of times the providers don't stay that long. So they'll stay a few years. You don't get paid as much. And by that, I mean, you're still getting paid, 100,000 plus per year. So you're getting paid well, but not as much as if you then own your own private practice or something, or have people work under you if possible.
Right. The next question. The next question is, you said that your father was a dentist, correct?
Yep.
Yeah. So were you ever desensitized when you were younger to the field, or were you always fascinated by the work that your father was doing and always said, okay, I want to be just like him. I want to be just like a dentist?
Good question. Definitely a little bit of both, personally. So how I chose dentistry over medicine, I think a lot of people, at least everybody I know in this field, considered medicine at one point. I think that people choose medicine or dentistry for different reasons. It's like a lot of PAs, I think, consider medicine, things like that. So I did consider, I was pre-med. I went into college pre-med after having been a dental assistant since I was in middle school, basically. I'd been a dental assistant for 5 years by the time I was in college. So I knew the field pretty well. I was comfortable in a dental office. I knew, of course, my dad owned his own dental practice. What turned me off to medicine was a personal story about, I told you we go to India every year. I've grown up with our kids in India, basically. They've known me since I was 13. I've known them since they were like 6, 7, 8. I have, friends there that are married now and have kids of their own. And it's, I've known these people in my life there. I consider them family, just across the world since I was a child. And I had a really close friend, and one of our kids die pretty suddenly while we were there one year. And it just shook me to my core. I realized I don't want to personally deal with life or death situations. My heart can't handle it. It's not something I wanted to have to experience, frequently. And I get really personally attached to my patients. My patients know everything about me. I know everything about them, as much as possible. If you follow me on TikTok, I'm not a closed book at all. I'm very open. And I have that communication with my patients. I didn't think I could tolerate medicine for that reason. If a tooth has to die, we'll get over it. You're going to be sore for a few days, and then, we move on. We can plug the hole again. You can't plug a hole of a dead, patient. So my heart, I thought, wouldn't be able to tolerate medicine. So that's kind of where I switched back into dentistry. I was also, again, really comfortable in the field. I love what I do. I'm really, my dad is a big teacher. He loves teaching. He loves, really explaining things to people. So I think I really learned so much, and I feel like I'm always like a sponge taking in more information. So yeah, a little bit of both. You falter, you might lean one way or the other, but ultimately I think this is a perfect choice for me.
Right. The next question we have is, does each school have its own interview day? And
yes,
because she's wondering if 2 dental schools are having the same day, the same interview day.
Yeah, don't worry about it. I mean, not to be like crass, but like it's unlikely that you'll run into that because one, I don't know any students that got into more than 7 dental schools. And dental schools do consider that, so they try to stagger them, and they have multiple days. So, for example, BU Tufts did 30 students in a day, and they offered you 3 days. So if, for example, my BU interview is on the same day, or if I have all 7 schools, they all offer me the same day, they all have multiple days, and they're going to offer you multiple days because they know, number one, you're going to have to travel there. So sometimes it's travel restrictions that you can't, get there for whatever reason, you can't miss an exam or whatever it is. They have multiple days that they'll offer you. but also you're not going to be up against, 30, 40 schools that are all trying to get you for that one day. You'll be able to make it work with your schedule. It is what it is. BU had way more days because they only had, I think, 6 of us on interview day, which was kind of nice. It was a little more private, I guess. So you'll be okay. Don't worry. Don't worry till you get in. Don't worry till you get that interview email, basically.
The next question we have is, if I don't get to obtain my degree by the time I apply to dental school, and say I never plan to take it, I never plan to get it, but have a high GPA and amazing extracurriculars and all the requirements, would that be possible?
I guess theoretically, but in reality, probably not. Basically what you're asking is probably more common to law. Like, can you take the bar exam, like the guy in Suits, if you watch that show? Can you take the bar exam, a lawyer? Legally, technically, yes. Does anybody do it? No. They want to see commitment to the field. And I don't know anyone that didn't have, for example, a bachelor's degree. If it's a master's, I don't think it would matter as much to not finish it, but not having completed your bachelor's degree and trying to go on to a doctoral level degree would not be something I would recommend. Theoretically, maybe. I don't know, but I don't think so. I think we were required, at least I had to tell, I applied while I was a senior in college. I had to tell them my expected graduation date. And I did have to send them proof of graduation. So I'm assuming no, but could be wrong.
Okay. Another question we have is, I'm from the Boston area, so I'm wondering if it's competitive to find a job as a dentist in the Boston area.
I thought you were going to say that you want to shadow me, because you should. Hit me up. I need a real shadow in real life. We have fun. We'll have fun. I practice in Needham. Boston's competitive, period. New England is really competitive. Doesn't mean you can't get a job. No, there's plenty of jobs available. Actually, there's job listing right now. I told you I worked in federal prison. You get a lot of money working in prison, something to always kind of keep on the back of your head, especially pay off loans. There's a prison job in Concord right now that nobody's taken for like a year and a half. I'm like, should I work part-time there? I really enjoyed my time. But anyways, no, it's a competitive location. You'll get a job. There's jobs available really anywhere. Where they're less saturated, for example, Vermont has like no dentists. I have patients that travel from Vermont because they're really limited. A lot of people think that they might have to, go up north, go to Vermont or something. No, there's plenty of jobs. You'll be fine. But also shadow me.
You said that you were working in the federal prison. How did that happen? Did you apply to work there, or did they reach out to you?
We do externships through dental school. So it's through dental school. Nobody signed up for it. So I was like, I'd love to go. I always loved lockup and shows about that. I also think that my heart always goes out to kind of underappreciated, underloved populations. I always want to try to spread that love and knowledge and experience, with those populations, like my kids in India who just were kind of forgotten a little bit. I chose that as my externship. So that's something that you'll have to do in dental school. Basically, you have your own dental school patients we had them for 2 years so that you treat patients on site at your dental school, but also you'll do externships and you'll do rotations elsewhere. I was in that federal prison for 3 months and it was incredible. And I learned a lot about patients with severe kind of medical needs. So my patients were medically compromised, really severely, usually, and just their needs really differ from the populations that I was used to or kind of had treated before. So a lot to learn there. Also a lot of love to give. Those guys were, sometimes in a really dark place. So usually not. A lot of my guys are super cheery. This was their home that I was visiting sometimes. So.
The next question we have is, what is your favorite procedure to do?
I get asked this all the time on TikTok and it's so funny. Sorry. It's so funny because usually I say surgery. I really do enjoy surgery. And I think I got that love bug for surgery because I was a surgical dental assistant for a long time. I also will preface that I did not apply to surgical residency. It was something I considered, or surgical, extra surgical training, because I didn't want all my life to be surgery. I like everything. I like a lot of variety. But I really do enjoy surgeries, usually until like last week. And I had a patient brand new to our office and I had to do a pretty difficult extraction. It took way too long, and I just felt bad for the patient. And it's like days like that, usually my answer is extractions or implant placements or surgery, period. And then, last week really it was just like, I need a week off from surgery. Let me do some fillings, like back, on the horse or whatever. But it varies. I feel like I'm so random about that. I really do like variety. I mean, you saw that case I love dentures because they're life-changing. You can, insert dentures and the patient's like sees their smile that they haven't seen in 30 years or whatever. So I like variety, but usually with surgery is my answer.
Okay. Well, what is something that you struggled in dental school?
Oh, good question. Different people struggle with different things. So something I struggled with is my memorizing things. If you haven't taken a biology class yet, just science in general requires a lot of memorization. That was really hard for me. I had a lot of concussions in high school. I struggled to kind of come back from that academically. I was a cheerleader, I was a snowboarder, it's a long story, but kind of mentally from my concussions, I really did struggle with just general memory things. So learning how I studied helped, but just the kind of grind of how much you have to read, how much you have to study, how much you have to keep in your brain at all times was difficult. It was a difficult learning curve for me. Separately, I was used to patient care. I was used to being an assistant, but then the pressure's now on me to perform that procedure that I've seen 100 times. I've learned about it. Now I have to do it. That transition was difficult. So going into third year was really hard for me. I found myself struggling with kind of mental health things, so anxieties. I didn't sleep the night before a big procedure, and even a small procedure, like stupid things like, well, now I look back on it, right? And they're easy procedures now, but they were not at the time, right? So I shouldn't belittle myself, but, a 3-surface filling, and now, it's going to be an exam. And should I have chosen that tooth for the exam? I wouldn't sleep. And then I'd get up and the patient would check in, and I have vivid memories of the box popping up saying that the patient checked in, and I'm like, oh God, I could throw up. I'm so nervous. So those transition periods were difficult for me. But again, different people struggled with different things. I think it's super important to not compare yourself with others. Check back in on yourself. What I struggled with were those things. What I didn't struggle with, for example, was kind of hand skills practice in simulation lab, but I had friends who had to, cut the same tooth 40 times to get it right. I didn't usually go out after those classes and kind of practice extra. So we all have different strengths and weaknesses. Definitely super important to remember that because, we all like to compare ourselves to others. But yeah, transitions, I think, was hard for me, patient care and starting patient care and just the grind of studying.
Right. So we're going to have 2 more questions. So the next one is there a fun experience that you had during dental school?
Just one. Dental school is fun. I mean, it's hard and nobody's going to tell you that it's not, because it is really difficult. But dental school in general is really fun if you love what you're doing. If you're trying to do this, to make money or whatever, this is not the field for you, because it's a grind, right? But I don't know, one experience. I don't know. I feel like I liked every day. We had a class ski trip. We had dental prom. Those are always fun. That's not something that they tell you guys about in the interview. Obviously, our dental prom got canceled, but every year they have this big ball and you all dress up and you're with your professors. And it's really cool because you get to, see them outside of clinic and stuff. Yeah, I don't know if I have just one. I feel like that's such a bad answer, but sorry.
Okay, so we're going to end it off with this question. So you did say that you're kind of all over the dental practice, seeing the hygiene patients, doing your own patients. So I feel like it's overwhelming, correct?
It can be. But
yeah. So how would you deal with stress or even managing the work-life balance?
Good question. And I think I'm still learning how to do it. And I think we're all constantly learning how to do that, especially during this pandemic. A lot of my patients, for example, are dealing with way more anxieties just in general. Broken teeth, like left and right. People are grinding their teeth like crazy because this pandemic, as a general overarching theme, has created way more stress than normal. How people deal with stress, I think, is going to differ, again, person to person. I think it comes down to a little bit of personality type. I don't get flustered under pressure. easily. So medical emergencies, I've experienced many medical emergencies in my pretty short career, for, better or for worse, but, things like that don't really stress me out or don't really fluster me. At the end of the day, your patients are people too. We had a patient last week, for example, that I felt so guilty. We had sent the case to the lab and they didn't send it back. And she shows up, she drove 30 minutes to get to her office. And it's like things like that stress me out because I feel so guilty. And I'm like, oh my God, we're failing this patient. And, she was totally understanding because I told her, I'm like, I'm sorry, we screwed up. We messed up big time with this case. And she's like, oh, it's fine. You guys have a lot on your plate. I totally understand. Patients are people too. I think kind of remembering that sometimes can help. How do I personally deal with anxieties? Geez, I don't know. My bulldog, extra cuddles from him, but, being mindful of it, I think is really helpful. Certain music's really helped me. I'm Christian, so I read the Bible regularly enough to kind of ground me and remind me that there's bigger things out there than me. I'm not fully in control all the time. God has a plan for this, that little mistake, for example. Maybe God has a reason that we couldn't insert that case that day or whatever. So I try to kind of remind myself I'm not the only one driving the bus, maybe. I don't know.
Okay, well, this has been an amazing session. I just want to thank you again for joining us.
Thank you guys for having me.
And so if you wanted to plug anything, definitely go ahead. I know you have a TikTok. Want to share that, your Instagram
Follow me
page?
on TikTok. I won't follow you back. I won't let you follow my private Instagram. So don't follow me on my private Instagram, but follow me on Brede Ciapciak Dental because I do respond to DMs. I'm always on my phone if you ask my husband. So shoot me a DM if you have other questions. Obviously, comment, ask me things on TikTok if that's your modality of communication. I'm super responsive. So I like getting questions. I love pre-dental students. I like sessions like this. I'll have a private session, discuss things personally with you if you want. I love things like this. I really like helping you guys. So don't be shy. Be a friend. If you're interested in going to India with me again, that's something we usually do annually. This year it's canceled because of the pandemic. So hopefully next year, if you're free next summer, hit me up. I'll send you some information, but that's about it.
Perfect. Thank you so much. So I just want to let everybody know that the link to the quiz will be up. I believe it is up right now. So you do have 24 hours to finish that and then you can receive your shadowing hours.
Awesome. Have a good night, everybody.